Welcome back to my channel. Today's topic affects women of reproductive age and is called menorrhagia, or abnormal bleed from the uterus. So what you'll learn are the definition, the causes, symptoms, diagnosis, and treatment options for heavy menstrual bleeding. Why does it matter? Menorrhagia may affect general quality of life and point to underlying medical problems. Menorrhagia may affect your daily life greatly and cause emotional pain. It can cause physical discomfort, problems in personal relationships, and so early diagnosis helps your doctors to find the reason and carry out effective treatments for controlling the condition. So what is menorrhagia? It is defined as the bleeding from the womb or the uterus, and is a common medical problem in women of childbearing age during which they have periods that are too heavy or last too long, lasting for more than 7 days, or with irregular timing leading to excess blood loss, which are all signs of menorrhagia. Having this happen could make it hard to do your everyday task and even affect your state of mind. So this means having heavy periods that soak through your pads or tampons in an hour, or you have to change your sanitary products often during the day and the night. In some cases, you could pass large blood clots, and you could even have intramenstrual bleeding, which is frequent, heavy, prolonged, or occurring between your cycles. So the following are the top 6 causes of menorrhagia. I could even say 7. And in medicine, it is called pathophysiology. So number 1, disruptions in the hormone levels of your progesterone and estrogen. Number 2, non-cancerous growths called uterine fibroids. Number 3, endometriosis, which is a medical condition that happens when tissue from the lining of the uterus grows outside of the uterus. 4 is adenomyosis. This refers to the growth of tissue from the lining of the uterus into the wall of the muscle of the uterus. Number 5, non-cancerous growths in the uterine or inside the uterus. They are called uterine polyps. Number 6 are any other bleeding disorders. And 7, it could be due to hormonal irregularities that interrupt the normal movement of the menstrual cycle, or it could be too much uterus tissue removal. Additional disorders like endometriosis, polyps, fibroids may result in excess thickness and irregular shedding of the womb fabric, which can then cause too much bleeding. What are the signs and symptoms? 1, bleeding that continues for more than 7 days. Soaking through your pads or tampons every hour, or even having to change your pads or tampons often at night. Passing big clots during your period. Pelvic pain or cramping. Feeling tired, weak, or dizzy due to large blood loss or blood loss that spans over a long time. So what will be the symptoms? For example, a woman will say she's bleeding a lot, or it can be hard for them to do normal things like socialize or do their job because they constantly feel weak, fatigued, and tired. So if you go to your doctor, they will ask about your medical history, which can include how bad and how long the heavy bleeding lasts, meaning the duration of intense bleeding. They will ask you about the length of the menstrual period, presence of your symptoms, including pain during sexual relations, which can be suggestive of endometriosis or adenomyosis. And they will also ask about previous conditions and medications, things like C-section and all. So what is required to make a diagnosis? There is not just one test. The diagnosis is based on how you describe your bleeding, how long it lasts, how it affects your daily life, along with the results of your physical check and the blood in the lab that your doctor sends for samples, or your imaging test. Now, your doctor will do some physical examination and to find what's going on clinically with you. They can do a physical pelvic exam to take a close look at the uterus and ovaries to find any problems. For example, they want to see the size and the shape of the uterus, as well as any signs of pain. Blood tests can be done to check hormone levels and rule out illnesses that can cause bleeding. Another one is ultrasound. Ultrasound will be used to look for tumors, polyps, endometriosis in the uterus and ovaries. They can also do an endometrial biopsy, which is a tissue sampling to rule out some conditions. And since pregnancy is a common reason for uterine bleeding, a pregnancy test is usually done. So if they diagnose you with this, how would you manage it? How would they treat it? The treatment approach depends on what the real problem is and what the woman wants. So there are non-medical therapies which are often tried first. If they are ineffective, then they will try medical treatment options, okay? So the aim is to reduce blood flow, control the pain, address the underlying cause, get to the root of the problem, which can involve some invasive treatments consideration. What are examples of non-medical therapy? Iron tablets. If you are anemic already from losing some blood, iron tablets can be tried. You can try eating pad or warm bath at home to help with the cramps. Stress management techniques are really huge. Stress can cause these issues. Menstrual cup or period underwear for heavy bleeding can be recommended. And, other things can be with weight management, exercising regularly, and so on. Examples of medical therapy, which means medication, depends on the primary cause. The following medicines can be prescribed. Contraceptive hormonal birth controls like pills, patches, IUDs to control periods and stop bleeding. Drugs can control ovulation like progestin-only pills. Then they can do non-steroidal anti-inflammatory medications like ibuprofen to reduce the cramps. They can do antifibrinolytics to slow down the blood flow. So it is important to keep it in mind, though, that, all those treatments work differently for everyone, and so it might not work for everyone as well. Key takeaways. Menorrhagia or abnormal bleeding from the uterus is a common but treatable condition. So if you experience heavy bleeding, seek medical advice, and various lifestyle and medical options that can help you manage the menorrhagia and improve your quality of life can be recommended by your provider. Thank you for watching this video and showing interest in the content. I'm sure you gained some important knowledge and became motivated to start improving your overall health. If you liked it, I would appreciate it if you thumbs up, share, and subscribe to my channel so you will be notified when I post wellness-related materials. Additionally, please feel free to contribute and propose topics in the comment section. Anyways, before I go, this video provides educational information only. This information should not serve as a replacement for expert medical guidance. Always consult your healthcare provider for diagnosis and treatment planning. And that's it from MedGems today. Thank you for watching. Bye.